Hello and welcome once again to this channel on health and wellness for all. I have been getting a question lately so many times. What is the right age to get pregnant? There is no simple and direct answer to this question. Let's learn more. So if you look at the hard facts and what is given in the books, the best age to get pregnant or to try for a pregnancy is between 18 or 23, 24 years of age. But this is a time when the women are completing their education and are starting to think about their careers. So what does happen if you plan a pregnancy at a later age? More women are either getting married later after the age of 30, 35, and therefore they are even planning their pregnancies later. We know that we are women and we are born with a fixed number of eggs. We have around 8 to 10 million eggs which are constant. And then as we age, these number of eggs start reducing. Some of these eggs just get wasted. What happens is that every month from when you start your period, 4 to 5 eggs start getting ready and one of them matures and that is released, which is called ovulation. Now if the pregnancy does not happen, this egg is just washed away. Also what happens is that the quality of eggs also reduces as the age increases. For the partner, the male partner, also if you look at their reproductive biology, the men are able to produce sperms even up to the age of 60 and more. But then again, the quality of the sperm, the count, the power of the sperm may reduce with age. The problems for the lady can be that with increasing age, there is risk of more chance of problems, medical problems such as diabetes, hypertension. There is an increased risk of miscarriage as the age increases in pregnancy. There is also increased risk of operative deliveries like cesarean section as the age increases. In terms of the fetus or the baby, with the increasing age of the parents, increasing age of the mother, there is an increased risk of chromosomal problems and aneuploidies, Down syndrome and other genetic issues. But don't just go by a lot of facts, because each person is different. Each individual has a different scenario and we have to see this as a case by case basis. What we can do is that if you are planning a pregnancy a little later, to make sure that whenever you plan your pregnancy, you are at your optimal health before that. Not just when you are planning your pregnancy, but much before that, maybe 6 months or 1 or 2 years before that also. So how do we do that? If you have problems like diabetes or hypertension, obesity, start working towards that, because it's not just in having a healthy pregnancy. Taking care of your lifestyle issues, taking care of what you eat, taking care of how much you sleep, how much stress you're having will also be good for you for your long-term health. Sometimes women are not sure about, say you're very young and there's a new concept coming up nowadays about the egg freezing, social egg freezing, where even the companies are paying for the women employees, for those who are either not decided about their pregnancy now, but then they want to secure the eggs. So there are concepts of egg freezing when you don't have a partner, or embryo freezing if you have a partner but you want to plan your pregnancy later. Of course, spontaneous pregnancies do happen even after the age of 35 and sometimes even 40. And also understand that the risk of the problems will increase if you have not taken care of your health. What you can do at this point is not decide or not go by what the society feels that is the right age for you. It is your own individual decision. It is your decision as a couple when you are planning to start a family. But whenever you do that, before that, much before that, start planning the pregnancy in such a way that you are at your optimal health, you are taking good diet, less sugar, less salt, less processed food, taking good water, taking rest, having adequate sleep, which is good for you, and trying to control the stress in your life so that whenever you are planning your pregnancy, that times you're in your optimal health. So meeting a gynecologist, meeting a doctor, trying to understand what will be the changes in your life with the pregnancy, how your health will be affected, is a good idea. But not always everything goes bad if you're having a pregnancy at a later age. There are studies which say that women who have pregnancies at a later age, they are more mature, they're more financially stable, and sometimes their babies have higher IQ than babies who are born to mothers at a younger age. So each person has a different ideal age in terms of what the plan is for them, because it depends on their situation in their life. So you have to be physically, emotionally, mentally, and also financially stable before you're planning your pregnancy. There are a couple of tests which can be done. One simple test, blood test, is called the AMH, or the anti-Mullerian hormone test, which can give us a rough approximate idea of the number of eggs or the ovarian reserve. So check for yourself and take